Hello guys, welcome back. Chal. Now let us start the next topic, tympanic membrane. Beta. Tympanic membrane is right at the end of the exonotory canal. I think you saw that video also, and you saw that when the external auditory canal ends, the tympanic membrane starts. This exonotory canal outer part has got hair follicle. Exonotory canal is lined by skin. Wax gland are also outside. Then you go deeper. Inside there are no hair follicle in the exonotory canal, and then this is the tympanic membrane. Can you see, beta? That's the tympanic membrane. Now let's discuss. Can you see the color and everything, shape and everything? Let us discuss everything in that now. It is also called marring, first of all. Whenever you see the word maringoplasty, marringotomy, you are thinking about tympanic membrane. Beta. Tympanic membrane is also called marring. So maringoplasty, marringotomy is tympanic membrane. Beta. It is what in color? Write down. It is pearly grey in color. It's not white in color. It's pearly grey in color. Beta. You can see it's like a pearly grey. Beta. Hyderabad pearls. Hyderabad pearls? Like a pearly grey in color. Beta. Oval in shape. Beta. It's not circular. It's oval. Oval in shape. The diameter is 9 to 10 millimeter. 9 to 10 millimeter. Diameter is 9 to 10 millimeter. Millimeter. Beta. Millimeter. The surface area is 90 square millimeter. 90 square millimeter, beta. This is exactly of the size of the Disprin tablet. Have you seen Disprin tablet, beta? Disprin tablet is the size of tympanic membrane. Don't think it's so big, beta. When we look at it, very big. No, it's not that big. It is very small membrane. It's size of the Disprin tablet, beta. Okay. The area is 90 square millimeter, but effective area is 45. Why the effective area is lesser? Because peripheral part of tympanic membrane is more mobile than central part. When I say mobile, what do you mean by it, beta? Mobile. I hope you remember, sound energy creates movement of tympanic membrane, beta. That movement of tympanic membrane moves the malleus, beta, incus, then stapes. So actually what happens is, look at the screen, beta. This is the central part of tympanic membrane. This is the peripheral part of tympanic membrane. Actually, peripheral part shows more movement than the central part. Therefore, the effective area is 45 square millimeter. This part doesn't show too much of movement, but peripheral part creates more movement. So peripheral part is more mobile than central part. Therefore, the effective area is 45 square millimeter. TM is lying at an angle of 55 degree with horizontal. 55 degree with horizontal, beta. TM is lying at an angle of 55 degree with horizontal, beta. All of you draw this, beta. This is external auditory canal. This is tympanic membrane, beta. The angle is 55 degree. Okay. With the external auditory canal, tympanic membrane is lying at an angle of 55 degree with horizontal, beta. Okay, 55 degree with horizontal. Look at me, beta. This is your external auditory canal. This is your tympanic membrane, beta. Tympanic membrane. Okay. Now please look at me. This is your external auditory canal and this is your tympanic membrane. It is not standing at 90. This is tympanic membrane, beta. This hand is external auditory canal. Okay. Now please see, it's not standing at 90, beta. It is bent like this. So this is tympanic membrane. The tympanic membrane makes an angle of 55 degree with the horizontal. When I say horizontal, horizontal means the external auditory canal, beta. Okay. So it has an angle of 55 degree with the horizontal, beta. Okay. Next point. TM shows movement on seagulization. Seagulization, beta. New word, beta. Bolo beta, kya naam hai? TM shows movement on seagulization. Everybody, what is the word? Seagulization. Bolo. Seagulization. What is seagulization? Seagulization means, first of all, look at screen, beta. Everybody look at seagulization, beta. Seagulization means this one, beta. Can you see? Seagulization. Seagulization means putting air pressure on tympanic membrane with the help of a speculum, which is called Seagull speculum, beta. This is what we call Seagull speculum, beta. Seagulization means, look at screen, beta. Look at screen. Seagulization means putting air pressure on tympanic membrane with the help of an instrument called Seagull speculum. Seagull speculum has got a lens and a bulb. Look at me, beta. You put this lens in the ear of the patient and you see like this, then you press this bulb and this is seagulization. Beta. Putting air pressure on tympanic membrane is technically called seagulization, beta. am I clear? Fine, is technically called Siegeleization. Okay, chalo. So read beta. Siegeleization means putting air pressure on tympanic membrane. It is done with the help of Siegel's speculum. Beta. Everybody mark it. This is Siegel's speculum. Beta. Siegel's speculum. Get used to the image also. Beta. This is what speculum? Siegel's speculum for the ear. Beta. The technique is called Siegeleization. The instrument is called Siegel's speculum. Beta. Now, TM has 4 landmarks. Beta. What are the 4 landmarks? Handle of malleus, lateral process of malleus, umbo, and cone of light. Why there are landmarks, beta? Look at screen, everyone. Why there are landmarks, beta? Guys, can you see what lies behind the tympanic membrane? Everybody, let us label this diagram, beta. Everybody, label a diagram with me. Just see over here. What is this, beta? This is external auditory canal. Okay. What is it, beta? Tympanic membrane. And then the first ossicle is malleus. Can you see malleus is actually attached to the tympanic membrane on the back side. This is middle ear, na? Okay. Malleus is attached to tympanic membrane from back side. Because it is so much attached to tympanic membrane from the back side, it is slightly visible through it. But is whole of malleus visible? No. This is the end of the tympanic membrane. This is tympanic membrane from here to here. What is this? This is the head of malleus. So head of malleus is above the level of tympanic membrane, so head cannot be seen. What is this? This is what? This is what? Handle of malleus. Handle. What is this process? Lateral process. What is the tip of handle called? Umbo. So you can see 3 things. One is handle of malleus. Then this process called lateral process of malleus. Then umbo is the tip of the handle. Okay. Now in the real tympanic membrane, if you see, this is your tympanic membrane. Okay. Now where is the malleus? First of all, let us focus here. Let me draw it for you. This is your malleus, handle of malleus, lateral process of malleus. Okay. Now please see, this is a handle of malleus. This is number 2, lateral process of malleus. This is number 3, umbo, and number 4, cone of light. Okay. Now all of you read your notes. Tympanic membrane shows 4 landmarks. Number 1, handle of malleus. Number 2, lateral process of malleus. Number 3, umbo. Umbo is tip of handle. And number 4, cone of light. I will remove the marking and you see now yourself. Can you see handle of malleus here? This one. This is number 1. This is number 1. This is number 2. Number 2 is lateral process of malleus. This is number 3. Number 3 is umbo. And can you see shining light? Number 4, cone of light. Everybody, are you clear about the 4 landmarks of tympanic membrane? Number 1, handle of malleus. Number 2, which process? Lateral process of malleus. Number 3, umbo. And number 4, cone of light. Am I clear? Fine. Now everybody go back to the notes now, see. Handle of malleus, number 1. Okay, number 1. Number 2, lateral process of malleus. Number 3, umbo. And number 4, cone of light. Okay, fine. Can you see in this diagram also, he has drawn, lateral handle of malleus, number 1. Number 2, put a number 1, number 2, lateral process of malleus. Number 3, umbo. And number 4, cone of light. Number 4, cone of light. Handle of malleus, can you please be sure? Handle of malleus is clear? Yes. Lateral process of malleus is clear? Yes. Number 3, umbo is clear? Yes. And cone of light is clear. Is it clear to all? Okay. Now, something about cone of light. How this cone of light forms? Cone of light is formed by reflection of light from handle of malleus. Cone of light is formed by reflection of light from handle of malleus. Which light? Light of otoscope. Light of otoscope. Otoscope has a light bulb. Na? Look at me, this tympanic membrane. The otoscope light strikes the tympanic membrane and it gets reflected downward. And that is called the cone of light. Cone of light is produced by reflection of light from handle of malleus. Which light? Otoscope light. Cone of light position. Right ear 5 o'clock, left ear 7 o'clock. Position is very much clear. Right 5, right on right 5, left 7. L 7. 7 is the L 7. L ko ulta karo 7. L ko ulta karo 7. Make the L reverse, it is 7. Right ear 5 o'clock, left ear 7 o'clock. Right ear 5 o'clock, left ear 7 o'clock position. Okay, bache? Okay, right 5, left 7. Okay, right 5, left 7. Beta. Okay, now this one is right. Write down right 5, left 7. Beta. Okay, now next one. Beta. Can you see beta right is 5? Beta. Can you see this one is at 5 o'clock? This one is 7 o'clock. Beta. Right 5, left 7. Beta. Okay, now next one. Now tympanic membrane has two parts. Beta. Pars tensa, pars flaccida. Beta. Number one, pars tensa. Highlight pars tensa. PT. Pars tensa is PT. Beta. Pars tensa. PT. It has three layers: outer skin, inner mucosa, middle fibrous layer. Okay, it has three layers: outer skin, inner mucosa, middle fibrous layer. Beta. Pars tensa makes the majority of tympanic membrane. Majority of tympanic membrane. Pars tensa makes majority of tympanic membrane. Beta. Pars tensa makes majority of tympanic membrane. Write down. It is a lower part of tympanic membrane. It is a stronger part of tympanic membrane. Add two word, beta. It is lower part of tympanic membrane. It is stronger part of tympanic membrane, beta. Lower part, stronger part, beta. Lower part and stronger part of tympanic membrane. Okay, fine. Pars tensa, outer skin, inner mucosa, middle fibrous layer, very strong part of tympanic membrane. No? Okay. Now look at me, beta. Look at me, everyone. Can you tell me tympanic membrane develop from which layer, beta? Ectoderm, endoderm, or mesoderm? Tympanic membrane develop from all the three layers, beta. Ectoderm, endoderm, mesoderm. If you go to embryology notes, beta, if you go to first part of the ear, development of the ear, tympanic membrane develop from all three layers: ectoderm, endoderm, mesoderm. Beta. Look at screen, beta. Ectoderm makes the skin, endoderm makes the mucosa, and mesoderm makes the middle fibrous layer. So all three layers makes one layer. Ectoderm makes the skin, endoderm makes the mucosa, and the mesoderm makes the middle fibrous layer. This is a 90% tympanic membrane is pars tensa only. The lower part, the bigger part is the pars tensa, and it is a stronger part. It is a very tense part, but a stronger part. But there is small part, pars flaccida, PF. Pars flaccida. It is also called Sharpnell's membrane is MCQ, beta. It's also called Sharpnell membrane. It is flaccida, beta. It is, write down, it is the upper part, weaker part, smaller part. Upper part, weaker part, smaller part. It is the upper part of tympanic membrane. It is the weaker part of tympanic membrane. It is smaller part of tympanic membrane. Tensa was bigger part of tympanic membrane, stronger part of tympanic membrane, lower part of tympanic membrane. Okay, but this one is upper part of tympanic membrane, weaker part of tympanic membrane, and smaller part of tympanic membrane. Okay, why it is weaker, beta? In this middle fibrous layer is almost absent, beta. Unfortunately, this area is weaker, flaccida, because in this you do not have any middle fibrous layer, beta. Okay, it forms a small upper part of tympanic membrane, beta. Okay, small upper part of tympanic membrane. You say, Rajiv, where is all this, beta? In the real tympanic membrane, if we see, where is the tensa and flaccida, beta? Now please see, this is the picture, beta. Now see, let us see this tympanic membrane and let us understand from the doctor which is tensa, which is flaccida, beta. Guys, can you see, beta? This is what, beta? This is the lateral process of malleus. Lateral process of malleus. Let us do one thing. Let us draw a line at this level, beta. Let us draw a line at this level of the lateral process of malleus. Draw a line, beta. Above this line is pars flaccida. Below this line is pars tensa, beta. Okay, beta. Can you see, beta, a small triangular area? This area, it's a weaker area, beta. Pars flaccida. Okay. Please see. Once again, revise. Pars tensa. PET means pars tensa. It forms the lower part of tympanic membrane. It forms the bigger part of tympanic membrane. It forms the stronger part of tympanic membrane. Pars flaccida is the smaller part of tympanic membrane. It is the upper part of tympanic membrane. It's a weaker part of tympanic membrane. The reason is tensa has got three layers: outer skin, inner mucosa, middle fibrous layer. But flaccida is flaccid because in this middle fibrous layer is almost absent. What is the separator between tensa and flaccida? Roughly a line at the level of the lateral process of malleus, beta. Okay, fine. All of you draw a diagram on the side, beta. Why not draw a diagram in your own hands, with your own hands, beta? All of you draw a diagram with your own hands, beta. Just to make sure everything you know, okay? Oval in shape. Draw a diagram like handle of malleus, like this. Label it, beta. 1, 2, 3, 4. What is 1? Speak about it. What is 1? Handle of malleus. Very good. What is 2? Lateral process of malleus. What is 3? Umbo. What is 4? Cone of light. 1. Handle of malleus. 2. Lateral process of malleus. 3. Umbo. 4. Cone of light. From here to here, PT, and this part is PF. And this is right tympanic membrane. It's a 5 o'clock. Right tympanic membrane. Right tympanic membrane is 5 o'clock. Chal. This was about the normal tympanic membrane, stories. Let us go further, guys. Now, everybody, this much we're done now. Next concept, beta. Everybody go to the page number 95. 95, beta. Main function of eustachian tube is middle ear ventilation, beta. Please understand, what is the main function of eustachian tube is middle ear ventilation, beta. What do you mean by middle ear ventilation, beta? Let us understand it. Middle ear ventilation. Everybody focus on the screen, beta, right now. Everybody focus on the screen over here. Just see, beta. Now, where are we actually, first of all? This is EAC, external aortic canal, and from outside the air is entering over here, beta. This is what? This is tympanic membrane. This is middle ear, beta. This is eustachian tube, beta. This is nasopharynx, beta. NPS, nasopharynx, okay? Now the same air is here also, no, beta? Air is here also. The air is also here also. The same air is entering from here, beta. Is entering the middle ear, beta. So, what is happening is, if this is tympanic membrane, both sides of tympanic membrane, equal air pressure is coming. On this side of tympanic membrane, external aortic canal is giving air pressure. On this side, eustachian tube, from nose to nasopharynx, air goes. From nasopharynx, please see, from nasopharynx, the air enters through the eustachian tube, and the yellow arrow, air enter the middle ear. And on both sides of the tympanic membrane, equal air pressure is there, beta. Okay, fine. Now, if eustachian tube is blocked due to any reason, there will be negative pressure in the middle ear, beta. Because air will not be able to enter from this side. When the air cannot enter from this side, means there is vacuum over here. What is vacuum technically called? Negative pressure. Negative pressure or vacuum sucks the things towards it, beta. Okay, now read your notes, beta. Now read your notes. If ET gets blocked, it will lead to negative pressure in the middle ear. This leads to retracted tympanic membrane. Okay. One problem was glue ear. If eustachian tube is blocked, I know you have a question. If eustachian tube is blocked, glue ear, yesterday topic. Yes, glue ear can happen. But another thing is retracted tympanic membrane can also happen. I think one etiology can cause multiple disorders. Smoking can cause oral cancer, laryngeal cancer, lung cancer, bladder cancer also, beta. Bladder cancer also for that matter. Okay. Similarly, eustachian tube blockage can cause glue ear, which we discussed yesterday, which we discussed today also. And it can also cause a negative pressure in the middle ear, which leads to retracted tympanic membrane, beta. What is retracted? In the bracket, go. Retracted in a simple language is sucked toward middle ear. Sucked towards middle ear. Retracted means sucked towards middle ear, beta. Sucked towards middle ear, beta. Okay, fine. Now, feature of retracted tympanic membrane, it is dull in appearance, beta. Can you see that pearly shine is gone away And if you see, this is retracted tympanic membrane, and you can see in this also, it is appearing as if somebody has sucked it from backside, beta. It is appearing as if something has sucked it from backside. Retracted matlab sucked toward middle ear. What has sucked it? The negative pressure in the middle ear, beta. Why negative pressure? Because eustachian tube has got blocked, and the air was supposed to enter in the middle ear through eustachian tube only, beta. Okay, fine. Now, next one, beta. Retraction pocket. Next, retracted TM. Now, retraction pocket. Now, what does it mean by retraction pocket? If there is too much of retraction, it will lead to formation of retraction pockets. Beta. Too much of retraction will lead to formation of retraction pocket. कुछ ज़्यादा ही suck हो गया. Negative pressure behind the tympanic membrane has sucked the tympanic membrane, but too much of retraction will lead to formation of retraction pocket. The retraction pocket is most commonly seen in pars flaccida. The retraction pocket is most commonly seen in pars flaccida. Pars flaccida. Why? It's a weak part of tympanic membrane, beta. Always like the logic, beta. There's a sidebar used there, beta. Weak part. Guys, weak part can be sucked too much inside. Nah? It's already weak, and behind that you put this vacuum. Don't think that vacuum can suck the pars flaccida too much. Too much of retraction will form a pocket, and that is called retraction pocket, beta. Now, retraction pocket is lined by skin. It is filled by keratin, beta. Retraction pocket is lined by skin. It is filled by keratin. Retraction pocket is lined by skin filled by keratin. Look at my hand, beta. Look at my hand. This is the outer cover of the tympanic membrane. What is it, beta? Skin. Skin, na? I'm the middle ear. I'm the middle ear. Outer side, external canal. What is the outer cover of the tympanic membrane? Skin. Skin. Now, if the pocket forms out of this, beta. Now, look at this, beta. If a pocket forms out of this, what will happen is that there will be over here, what is lined by, retraction pocket is lined by what? Skin, na beta? Retraction pocket is lined by skin. Please see over here, beta. This is the outer cover of the, outer layer of the tympanic membrane, beta. Okay? This layer, beta. This layer I'm talking about. This layer is what? Skin layer, beta. Skin, na? Skin layer. Now, this is skin layer, beta. Okay? Now, if this is the outer layer is skin, and if this makes a pocket, this pocket will be lined by what? Pocket will be lined by what? Skin, na? And skin makes what? Dead skin, na? And this is called retraction pocket. And retraction pocket will be seen more commonly in the upper part of tympanic membrane, which is a weaker part of tympanic membrane. And that part is called pars flaccida. Now read your notes again. Too much of retraction will form retraction pocket. And retraction pockets are more common in pars flaccida. And retraction pocket is lined by skin. It is filled by keratin. Retraction pocket is lined by skin. It is filled by keratin, beta. Am I clear, beta? Fine. This is clear. All of you, please label it. This is retraction pocket, beta. This is retraction pocket. This one. Retraction pocket. Oh, this is pars tensa is okay. Flaccida has a gadda. Flaccida has a gadda, and this gadda is called retraction pocket, beta. This gadda is called retraction pocket. It is lined by skin, beta. This is skin. This is what? Keratin, beta. Retraction pocket is lined by skin. It is filled by keratin, beta. Too much of retraction will form the retraction pocket, beta. Okay? So, this gadda is called retraction pocket. It is lined by skin. It is filled by keratin. I hope it is clear to all. Okay. Now, please see on the screen, beta. Please see over here. Can you see retraction pocket in pars flaccida? It is lined by skin. It is filled by keratin. Everybody mark it. This is the retraction pocket, beta. This is the retraction pocket. Retraction pocket is where? Not here, beta. This is the retraction pocket. Chalo. Diagram is ready. Clear? Is it clear to all? Okay. So retraction pocket. Now next further, beta. Now next, let's go further, beta. Next page, beta. Now let the story continues, beta. Picture abhi baki hai. The story is still evolving further. If retraction pocket is allowed to progress, there will be small perforation at the tip of the fundus of retraction pocket. There will be small perforation at the tip of the fundus of retraction pocket. Through this perforation, the skin start growing into the middle ear, beta. Through this perforation, the skin start growing in the middle ear, beta. All of you draw it, beta. This is skin. The skin start growing in the middle ear. This skin in the middle ear, presence of skin in the middle ear is called cholesteatoma. Presence of skin in the middle ear is called cholesteatoma. One day, the retraction pocket will rupture, and from the ruptured point of the retraction pocket, the skin will gain entry into middle ear. The skin in the middle ear is called cholesteatoma. And what is the color of cholesteatoma? It is pearly white in color. Skin, na? Skin is keratin, na? Keratin. It will make keratin, na? And the keratin is white in color, beta. Guys, please understand. Retracted TM, retraction pocket. One day, retraction pocket will rupture and there will be perforation at the tip of the fundus of the retraction pocket. Through this perforation, skin will grow into the middle ear. Skin in the middle ear is technically called cholesteatoma. Today you understand. What is cholesteatoma? Cholesteatoma is not anything very difficult to understand. Skin in the middle ear is called cholesteatoma, beta. Okay? It is pearly white in color and this is the look of the cholesteatoma, beta. This is the look of the cholesteatoma, beta. Okay, cholesteatoma, beta. Okay, am I clear, beta? Fine. It's the look of the cholesteatoma, beta. Everybody, look at screen, everyone. Look at screen, everyone. Now see this story, beta. See this story, beta. What is this? This is normal tympanic membrane. What is this, beta? Retracted tympanic membrane. The story continues. What is this, beta? Retraction pocket. And finally, what it will make one day will be the cholesteatoma. Is it clear to all, beta? The story is like normal tympanic membrane, this one. Then comes the retracted tympanic membrane. Then story grows further. It forms a retraction pocket. And then one day it makes the cholesteatoma, beta. Is it clear to all, beta? Is the story clear to all? Normal tympanic membrane, eustachian tube got blocked, retracted tympanic membrane. Too much of retraction marks the retraction pocket. Retraction pocket ruptured and the skin started growing in the middle ear and this is called cholesteatoma, beta. Can you see this, beta? Everybody is clear? I'm just going to be out of the scene. You see. Can you see normal tympanic membrane, number 1 picture? Then you see retracted tympanic membrane, number 2 picture. Then retraction pocket and then cholesteatoma, beta. This is all the problem of eustachian tube dysfunction. Can you understand how important the eustachian tube is? Okay. Now, let us study eustachian tube, beta. Now, before that, one more thing, beta. Just add to your notes, beta. Add your notes. Just see on the screen, beta. You must have done it in earbuds, no? By chance, earbud goes inside. It damages your tympanic membrane and you will get a perforation, beta. Can you see a traumatic perforation, beta? Traumatic. Can you see the earbud has gone through and through the tympanic membrane and it has damaged the tympanic membrane. It has caused a perforation of tympanic membrane. And this is called traumatic perforation of tympanic membrane, beta. Am I clear? Fine. Chal. Traumatic perforation of tympanic membrane. Now, everyone, just add one line to this, beta. On the side, write down. Here only, you can write. Treatment of choice of traumatic perforation of tympanic membrane is conservative treatment. Means no treatment required. Conservative treatment, beta. Conservative. Give the nature a chance, beta. In the bracket, just keep ear dry. Just keep the ear dry, beta. No ear drops. Don't put any ear drop, beta. No ear drops. No ear drop, beta. No ear drops. No ear drops needed. That's the MCQ, beta. Traumatic perforation does not need any treatment, beta. Traumatic perforation will heal on its own in most of the cases. Just the treatment of choice is conservative treatment. Conservative treatment is MCQ, beta. Put a star. MCQ. Traumatic perforation of tympanic membrane. How to treat it is conservative treatment. Just keep the ear dry. No ear drop should be given even better. Okay, look at screen beta. Can you see it? The earbud went through and through, and the perforation happened beta. And the perforation happened. Earbud went through and through, and perforation happened over there. This is perforation happened. Okay, this one. And now, if you give time to nature, just keep the ear dry, it will heal better. Can you see the fresh perforation? And if you keep the ear dry for a few weeks, the perforation will heal totally better. Can you see? There is no evidence of perforation here better. Nature has already healed the perforation. You know, there is a complete chapter of wound and healing in pathology. Wound and healing is a big chapter in pathology, fibroblasts, etc., etc. तो मुझे लगता है वो पूरी कहानी है. It's a fiction. It's a fiction, beta. No, it's a reality. All these things can grow and cover the gaps, beta. Okay? So, this is the traumatic perforation. After a few weeks, it's a healed perforation without any treatment, beta. So, treatment of choice of traumatic perforation is conservative treatment, no treatment required. Just keep the ear dry. Don't even put any ear drops, beta. Okay? Chalo. Now, let's go further, beta. Next topic. The next topic is Eustachian tube, beta. Let us discuss Eustachian tube. By now, you know Eustachian tube is very vital for your ear, beta. Let's discuss few important points about Eustachian tube. We call it ET, beta. ET. It connects middle ear to nasopharynx. Yes, I remember middle ear to nasopharynx. Okay. Its nasopharyngeal opening lies 1.25 centimeter behind the posterior end of inferior turbinate. I hope you remember, right behind the nose is nasopharynx. What was choana? Anybody? What was choana? Choana was the posterior opening of nasal cavity. Behind the choana is nasopharynx. How behind is the Eustachian tube opening from the nose, beta? Look at the line, beta. Its nasopharyngeal opening lies 1.25 centimeter behind the posterior end of inferior turbinate. If you remember, the turbinates go till the end of the nose, beta. Okay? When the nose ends, turbinates end. 1.25 centimeter behind that area is the nasopharyngeal opening of the Eustachian tube. Okay? Now, how much is the length of it? It is 36 millimeter in length. 36 millimeter in length. Outer 12 millimeter is bony. Inner 24 is cartilaginous. It is 36 millimeter in length. Outer 12 millimeter is bony. Inner 24 is cartilaginous. Okay. At birth, it's nearly horizontal tube, beta. At birth, it's nearly horizontal tube. At birth, it is nearly horizontal tube. But in adults, it has 45-degree angle with horizontal. In children, it's nearly horizontal, but in adults, it has 45-degree angle with horizontal. 45-degree angle. Anybody, what was the angle of tympanic membrane with horizontal? 55 degree. What is the angle of Eustachian tube with horizontal in adults? 45 degree. In children, there is no angle, it's horizontal. Okay. The main function of Eustachian tube is middle ear ventilation. Middle ear ventilation. The main function of Eustachian tube is middle ear ventilation. We just wrote that it sends air in the middle ear. The main function of Eustachian tube is middle ear ventilation, and also, I hope you remember, it also let the mucus of the middle ear come to the pharynx also. Okay? Okay, fine. Now, which muscle opens the tube, beta? MCQ. Tensor palati is equal to tensor villi palatini muscle. Tensor palati or tensor villi palatini muscle, beta. Tensor palati or tensor villi palatini muscle, beta. Tensor palati or tensor villi palatini muscle, beta. Okay, it opens the tube during swallowing. Whenever you swallow, look at me, you're swallowing at any given point of time. What are you swallowing? Saliva. Saliva, beta. We are unconsciously swallowing saliva very regularly, beta. So there's a very natural thing linked to that swallowing of saliva or food, even that matter. Whenever you swallow, the tube automatically opens and the air goes in the middle ear. So middle ear is continuously being ventilated. Don't worry about it. You need not do any conscious thing to ventilate your middle ear. It's connected to your swallowing beta. When you swallow, the tensor palati or tensor villi palatini muscle opens the tube actually automatically. Now this is 36 millimeter in length beta. Please see, it is the total length. Look at beta. This is 36 millimeter in length beta. 36. How much is total length? 36. But can you see beta? The outer 12 millimeter, this one. Outer 12 millimeter is bony. Which bone it is? Temporal bone. Don't forget. Every ear is nothing but temporal bone. Outer 12 millimeter is bony. But inner 24 millimeter is cartilaginous beta. So total length is 36 millimeter. Outer 12 millimeter is bony. But inner 24 is cartilaginous beta. Am I clear? Very good. Okay. Now, which muscle opens it? Tensor palati or tensor villi palatini muscle beta. Okay, beta. Chalo. Now, let us discuss the star topic of your exam, glue ear beta. We have discussed it multiple times in the pharynx also. Let us discuss from the ear angle now beta. Glue ear. Glue ear, first of all, is equal to SOM. Glue ear, nowadays we don't call it glue ear. The more popular name is serous otitis media. Look at the name beta. First line, glue ear is also called as serous otitis media or secretory otitis media. Look at the name beta. When you read, think carefully. Serous matlab non-infective. Serous, not suppurative. Suppurative matlab pus. Serous mane transudate. Just a non-infective fluid in the ear beta. Okay. Now it is collection of sterile. The keyword is sterile beta. Under the keyword, it is collection of sterile, thick glue-like fluid in the middle ear. Sterile, thick glue-like fluid in the middle ear beta. It's collection of sterile, thick glue-like fluid in the middle ear. Okay. Basic etiology is ET blockage. Basic etiology is ET blockage. Beta. We have been discussing since yesterday. If your sacral tube is blocked, the middle ear can get glue ear beta. Okay. The most common age is school age children. This is mostly a disease of school age children. Most common age is school age children. Most common age is school age children beta. Now, what are the causes of ET blockage beta? Number one, write down A and B beta. A and B. Most common causes adrenal hypertrophy causing ET blockage, mostly bilateral. If you remember, eustachian tube blockage will be bilateral. Adenoid cause bilateral glue ear mostly beta. Adenoid is midline. It causes bilateral glue ear mostly beta. Yesterday class of pharynx beta. Adenoid mostly cause bilateral glue ear beta. Seen in school age children. Adenoid is a problem of school age children. I'm sure you would be remembering this picture beta of open mouth beta. Remember the child with open mouth beta. Adenoid face beta. So mostly adenoid story is linked with the glue ear story beta. And adenoid mostly cause bilateral glue ear. So always when you think like a doctor, the question come, adenoid mouth breathing child with hearing loss beta. These children are looking like sort of little disturbed, and they have got a hearing problem also because adenoid is very commonly married to glue ear beta. Okay. So these two questions are integrated questions beta. Adenoid problem with glue ear problem. So treatment is also integrated actually. Now, the rare cause beta. Both are star MCQ first of all. Rare cause is NPC, nasopharyngeal carcinoma, more common in China beta. NPC causing ET blockage, mostly unilateral. Unilateral, seen in adults. Mostly unilateral, seen in adults beta. Seen in adults. Mostly unilateral, seen in adults beta. Okay? Seen in adults. Am I clear beta? Adults. Okay. Can we go further? So I know mostly adenoid is the cause, and adenoid causes bilateral glue ear seen in school age children. Rarely there can be a cancer which is uncommon in India, nasopharyngeal carcinoma, that causes this problem in adults, but it is unilateral. Clinical picture. Mostly school age child. Let us not forget this child. This is adenoid child. School age child complaining of heaviness in the ear. This child has got glue in the middle ear beta. Heaviness in the ear, and it's not a painful disease beta. This is MCQ beta. Is glue ear painful? No, it's not painful beta. Only heaviness in the ear beta. Why heaviness in the ear? Because this poor child has got something in the middle ear which is filling it, beta. Can you see over here? Middle ear, this tympanic membrane, behind that, can you see air bubble here? The air bubbles are trapped within the glue. This middle ear is full of glue-like fluid, beta. Okay? And this filled up fluid feeling in the ear will give heaviness in the ear, but it is not painful, beta. It's not infection. It's not painful. Only heaviness in the ear. Okay? Now, due to this glue-like fluid in the middle ear, can you hear properly? Not at all. There will be hearing loss, beta. There will be what type of loss? Conductive hearing loss, beta. Which leads to poor school performance, beta. Poor school performance. Poor school performance. Which lead to poor school performance, beta. Please understand it. When you can't hear properly, how can you take the dictation? Your teacher, you are second class student. This is second class student, beta. Second class student, and the teacher taking dictation. Teacher saying, write the spellings of mango. Mango, beta. She says mango. You are not able to hear mango because you have a hearing loss. And you say, probably she's saying tango. You said tango, T-A-N-G-O. Teacher says wrong. Wrong, 0 marks. You fail in the class. It's not that you are not intelligent. You are not able to hear properly. Because you are not able to exactly hear, did she say mango or tango? So you wrote tango. So you failed in the exam, beta. So poor school performance category, beta. Plus minus adenoid phase. Nobody would forget it. This adenoid story is married to glue ear story, but adenoid children are actually having glue ear very commonly. This is a doctor thing, beta. This is integration, beta. This question will surely come in the exam in one or other format, beta. Glue ear is such a popular topic that it is coming every now and then. Something or other is coming out of glue ear, beta. So imagine adenoid child like this kind of problem will have hearing loss also, beta. Okay. Examination. Glue-like fluid behind tympanic membrane. Air bubble trapped within the glue, beta. You just saw that there was a glue-like fluid behind tympanic membrane, and can you look at it, beta? This is the air bubble, beta. Air bubble trapped behind the tympanic membrane in the glue, beta. Okay, I can see the fluid level also, beta, over there. Now the next one, beta. Treatment is surgery. The surgery, marringotomy. What is marring, beta? What is marring? All draw. Marring means tympanic membrane. Otomy means cut. To give a cut on the tympanic membrane. Can you see marringotomy, beta? Tympanic membrane, somebody is giving a cut on that, beta. Marringotomy. Marringotomy in which quadrant? In antero inferior quadrant. Marringotomy in which quadrant? Antero inferior quadrant. Antero inferior quadrant. Marringotomy in which quadrant? Antero inferior quadrant, beta. Okay. Plus grommet insertion. Plus grommet insertion. Grommet insertion, beta. This is grommet, beta. Grommet. This is grommet, beta. Grommet like which shape? Dumbbell shape, beta. Dumbbell shape. Dumbbell shape. It is very small, beta. Very small. It's like a rice grain, beta. Again a rice grain. It's very small. Look at me, beta. This it's not a very dumbbell. ऐसा नहीं dumbbell है. It's a small like this. This much. इतना सा छोटू सा होता है एकदम से. It's rice grain like, beta. Dumbbell shape, beta. So what do? You do the marringotomy. Can you see? You do give the cut on tympanic membrane. Marringotomy to give a cut on tympanic membrane. Then you put a suction there. You suck the glue out, and then you take the grommet, and in the same cut you put the grommet, beta. Can you see, beta? Can you see this white ring-like thing? This is one part of this, beta. This is this ring visible over there. The other part is inside, towards the middle ear side, beta. So whenever you see a white ring-like thing in the tympanic membrane, mark it what it is. It is grommet, beta. Grommet. Okay. How to remember it? Write down the side, beta. Write on the side. G for glue. Glue needs grommet. G for glue. Glue needs grommet. Grommet word will not come anywhere in the exam, beta. Only for glue ear, or also called as serous otitis media. Remember, glue ear, also called as serous otitis media. Glue needs grommet, beta. Glue mange grommet. Glue mange grommet, beta. Okay, bache? Marringotomy with grommet insertion. Okay. Plus minus adenodectomy, beta. Yes. Plus minus adenodectomy also. Don't forget, never ever see adenoid and glue ear separate from each other. If the question mentioned mouth breathing child with hearing loss. Mouth breathing child, adenoid hypertrophy. Hearing loss, glue ear. Adenoid is very commonly combined with glue ear in the MCQs also. Mouth breathing child is a hint for the adenoid hypertrophy. Hearing loss is a hint for the glue ear, beta. So treatment is myringotomy plus grommet insertion. Grommet is also called middle ear ventilation tube plus minus adenodectomy. Okay, beta? Fine. Just see on the screen, beta. Just see on the screen, everyone. Please see. This is the myringotomy which has been done, beta. Myringotomy. Can you see? This is tympanic membrane. This is the cut on tympanic membrane. This is myringotomy side. This is a suction tube. And this is the glue coming out of the middle ear, beta. Can you see? This suction is sucking the glue out of the middle ear. Now, please see. It's so thick, like a Fevicol, beta. You can make a long string out of this also, beta. If you're free in the operation theater, you don't do anything. Can you see it's a long string? Can you see really the glue, beta? Glue. Glue here is really like a glue, beta. Please see. Again, once again, see, beta. See, this is the myringotomy done over there. Tympanic membrane is there. You gave a cut over here. This is myringotomy. Then suction is sucking the glue out. Can you see? The glue is so thick. It's like a Fevicol, beta. Once you've done this one, then you do what? Then you put the grommet over there, beta. In the same hole, you put a grommet also, beta. What is this, beta? Grommet. Can you see white ring-like thing? Grommet, also called middle ear ventilation tube. In the same hole, you put what? Grommet. Do not worry. This within few months, nature is going to push it out, beta. You need not remove the grommet. Nature will push it out, beta. It will keep it for a few months and nature will push it out. This what is it, beta? In the same hole, you put what? Grommet. What is grommet? Middle ear ventilation tube, beta. Middle ear ventilation tube. Am I clear, beta? Fine. Perfect. So myringotomy with grommet insertion. Glue needs grommet, beta. I hope you're clear about it. I hope you're learning. I hope you are enjoying the day. My concern is not, finishing ENT. My concern is that you should become informed physician about ENT topics, beta. Later on, when you go open your practice, you should be knowing when some doctor writes, plan is myringotomy, grommet insertion. You should know about it as a doctor. Okay? Fine. Chalo. Next one, beta. Next topic. Middle ear. Everybody, open up the next topic. Middle ear, beta. Middle ear. Now, middle ear, it's also called as tympanum. Middle ear is also called as tympanum. Tympanum. Now, myring, tympanic membrane. Tympanum, middle ear. Please understand. Myringoplasty is the middle ear surgery or tympanic membrane surgery. Tympanoplasty is middle ear surgery. So, whenever you see the word myringotomy, myringoplasty, think of tympanic membrane. When you say tympanotomy, tympanoplasty, tympanometry, think of middle ear, beta. Now, middle ear is a hollow cavity in the temporal bone. I already told you, ear is nothing but temporal bone, beta. External ear, middle ear, inner ear. So, you finished the external ear. Now, let us start the middle ear. Let us go behind tympanic membrane now. Okay? Now, middle ear has three parts, beta. Write down M, E, and H. Mesotympanum, epitympanum, hypotympanum. Meso means middle part. Epi means upper part. Hypo means lower part. Write down in the bracket. Meso is middle part. Epi, upper part. Hypo, lower part. Middle part, lower part, upper part. Middle part, lower part, upper part. Of course, epi means upper part, hypo means lower part, meso means middle part. Not a big deal, beta. But just to make it clear, beta. Everybody look at me, beta. Look at me, everyone. This is your middle ear. How to understand this? This is your middle ear, beta. This is your middle ear. This is the middle ear. Now, this is your tympanic membrane. Tympanic membrane. Tympanic membrane does not cover the middle ear fully. It covers majority of it, beta. Okay? Now, look at this. This is tympanic membrane. Tympanic membrane is not that big that it can cover the middle ear fully, beta. Middle ear is bigger than tympanic membrane. So, middle ear covers majority of tympanic membrane. The tympanic membrane covers majority of the middle ear. The part of the middle ear which is covered by tympanic membrane is called mesotympanum. Look at my finger, beta. The part which is left above is called epitympanum. The part which is left below is called hypotympanum. Epi and hypo are covered by bone. Which bone? Temporal bone. Epi and hypo are covered by bone. There is a bone cover here, the bone cover here, beta. So, my finger are the epitympanum, my thumb represents the hypotympanum, and this is the mesotympanum. So, mesotympanum is that part of middle ear which is covered by the tympanic membrane, beta. Now, look at your notes, beta. Mesotympanum is covered by tympanic membrane. Mesotympanum is covered by tympanic membrane. Okay? Okay? covered by tympanic membrane. It is the middle part of middle ear. It is a major part of middle ear, beta. It forms the, in the bracket, major part. The majority part of middle ear is mesotympanum, beta. Okay, bache? Fine. Then comes the epitympanum. Epitympanum also called as attic, beta. It is covered by bone called scutum, S-C-U-T-U-M, MCQ, beta. Attic is the question. You should know attic. I hope you know English meaning of attic. Attic means upper part of your house, beta. You know attic of the house, upper part of the house, attic. Attic means upper part of the middle ear, attic. Epitympanum is also called attic. It is covered by bone which is called scutum. Scutum, beta. Everyone look at screen, beta. Now please look at there. This is your external auditory canal, tympanic membrane. Okay, beta. External auditory canal, tympanic membrane, beta. Can you see middle ear from here to here is middle ear? This is mesotympanum. This is what a epitympanum. It's covered by bone called scutum, beta. This is scutum. Okay, label it, beta. This is scutum, beta. Everybody, this is your scutum, beta. Label it scutum, beta. Scutum label karo. This is external auditory canal. Label it. Of course, this tympanic membrane. Okay, this is inner ear, beta. This is middle ear. Epi, meso, hypo, beta. Epitympanum is upper part of middle ear. It's also called attic. It's covered by bone called scutum. Have you labeled it? Have you labeled it, beta? Okay. Am I clear? Fine. Very good. Okay. Chale aage, beta. Fine. Now, let's go further, beta. Hypotympanum is also covered by bone. Can you see hypotympanum? Is also covered by bone. There is no name of that bone, beta. It's unnamed bone, beta. Main thing is scutum, beta. Scutum is the bone which covers the epitympanum, also called as attic, beta. Attic is the other name of epitympanum. It is covered by bone called scutum. Nobody will forget the scutum word, beta. S-C-U-T-U-M. S-C-U-T-U-M, beta. Now, depth of middle ear, beta. Epitympanum 6 millimeter. Meso to hypo 4, beta. 6 to 4, beta. 6 to 4. So mesotympanum is the narrowest part of middle ear. Epi is the deepest part of middle ear. I'm not saying the largest size, but size wise, of course, please see, I'm largest size. Meso is the biggest part of the middle ear, beta. Mesotympanum is the biggest part of the middle ear. I'm not saying the size, beta. Length wise. Length, of course, this is biggest, beta. But depth wise, depth means this distance, beta. Depth, this distance, depth. Meso is little narrow part. Epi is little wide part, beta. Epitympanum is the widest part of middle ear, beta. Okay, 6 to 4, beta. Very good. Now, let's go to the next topic. Sensory supply of middle ear. Doctor, मेरे कान के अंदर दर्द हो रहा है. I have pain right in the deep of my ear actually. Sensory supply of middle ear is by tympanic branch of glossopharyngeal nerve. Ninth nerve, beta. Ninth nerve, beta. Try to recall ninth nerve. Yesterday also it came. Glossopharyngeal nerve was in the bed of the tonsil, beta. Oh, it was in the bed of the tonsil. Okay, fine. Remember, in the bed of tonsil there is what? Styloid process, and which nerve? Glossopharyngeal nerve. Okay, and this the same nerve gives a branch to the middle ear. What is tympanum, beta? What is tympanum? Tympanum is the middle ear, beta. Tympanic matlab middle ear branch of the glossopharyngeal nerve, also called as Jacobson's nerve, beta. Jacobson's nerve. Okay, now rhaphidotalgia mane earache, beta. Earache. Earache referred from somewhere else, beta. The ear is normal. Ear is normal, but pain is in the ear. Some other structure is referring the pain to the ear, beta. Ear. Okay. Now, very important. Tonsillectomy. Now, this is the MCQ possible in your exam, beta. Why tonsillectomy causes pain in the ear? Why? Which nerve lies in the bed of tonsil? Ninth nerve. Which nerve supplies the middle ear? Ninth nerve. Same nerve supplies the tonsil, same nerve supplies the middle ear. That's why pain of the tonsil is referred to the pain of the ear actually. Okay? Tonsillectomy. Tonsillitis. Tonsillitis, beta. Styalgia. Remember eagle syndrome, beta. Write down eagle. Try to recall, beta. Eagle syndrome. Yaad hai, beta? Visual, pictorial. Eagle. You remember eagle was holding the snake. The snake was what? Ninth nerve, beta. What is ninth nerve? Glossopharyngeal nerve, beta. Okay? And cancer of base of tongue. These all things cause earache via ninth nerve, beta. Which nerve? Ninth nerve, beta. Now please do not forget tonsillectomy, beta. Tonsillectomy causes earache via ninth nerve. Nobody will forget this one, beta. Extra information. You want to remember it, you can remember it, but nobody will forget. They will make a story. The child underwent tonsillectomy today. Tomorrow, the child started crying with the ear pain. Which nerve is responsible for referred earache? The answer is ninth nerve. Because I know as a doctor, anatomy also now, that tonsil bed has got ninth nerve and middle ear is supplied by tympanic branch of the ninth nerve only, beta. Okay. Now, one more advanced question. Supraglottic cancer and pariform sinus cancer. Yeah, it came day before yesterday also. Laryngeal cancer. Supraglottic, if you revise supraglottic cancer, the first symptom was throat pain referred to ear. Okay, pariform sinus came yesterday, part of hypopharynx, beta. They cause earache through which nerve? 10th nerve, beta. Vagus nerve, beta. Vagus nerve. Try to recall. Larynx is supplied by vagus nerve, beta. RLN, SLN branches of vagus nerve, beta. And ear is supplied by auricular branch of vagus nerve, beta. Try to recall, beta. You wrote in the exonotrical nerve supply, the ear is supplied by auricular branch of vagus nerve. And larynx is supplied by vagus nerve, RLN, SLN branch of vagus nerve, beta. Just apply your mind, beta. When you revise supraglottic cancer, it will be written throat pain referred to ear. Throat pain referred to ear through which nerve? 10th nerve, beta. But which question I would request you to not forget is tonsillectomy, beta. बाकी सब extra information के चक्कर में main बात ऐसा ना दिमाग. Tonsillectomy causes earache through glossopharyngeal nerve. Tonsillectomy causes earache through glossopharyngeal nerve, beta. Glossopharyngeal nerve. Tonsillectomy causes earache through glossopharyngeal nerve. Nobody will forget this one, beta. Chalo, beta. Now, the next topic, beta. 6 walls of middle ear, beta. 6 wall of middle ear, beta. Next topic, everybody open up. 6 wall of middle ear, roof of middle ear, floor of middle ear, anterior wall, posterior wall, lateral wall, medial wall. Lot of time I was confused in my MBBS days that what is the roof, what is the floor, what is the anterior wall, what is the posterior wall. Jacket to okay, roof, वो कहाँ है उसको भेजना है वो जो थोड़ा पतला वाला क्या है ना हाँ लाल जी को भेजो roof, floor, anterior wall, posterior wall, medial wall, lateral wall. Let us see on Lalji that what is the roof, what is the floor, what is the anterior wall, posterior wall, medial wall, lateral wall. देखो तो कितना कुछ लिखा हुआ है बेटा, है ना? पहले समझ आएगा तभी तो हम पढ़ पाएंगे, है ना? इसको सारे को समझ के करेंगे, समझ के याद करना है, याद तो करना है, समझ के याद करना है. ऐसे नहीं रट्टा नहीं मार लेना बिल्कुल. You know what? एकदम spinal level पे नहीं. Understand it, memorize it. Without memorizing, understanding is useless. Let me tell you, write on the wall in your room. You understand it very well. It's of no use till the time you memorize it, beta. Understanding is a good thing, important thing. But memorizing is the end result of hard work. 2 times, 3 times, 4 times. Then only you will be able to recall that thing in the exam, beta. So make sure that you're not really, having this thing that, okay, you are just understanding something very nicely. You understand the whole, can say something like a respiratory physiology, but you did not, revise it, then what's the purpose of this, beta? Okay. So let's understand the anterior wall, lateral wall, posterior wall and all that. Now we have Lalji. Thank you very much, Lalji. Lalji, come here. Now please see. Now, first of all, this is the ear. This is the roof of the ear, beta. Above the roof of the ear is brain. Which part of brain? Temporal lobe of brain, beta. So, roof is clear, beta. Roof is towards the brain side. Above the roof of the ear is the temporal lobe of the brain, beta. Now, this is floor. Floor. Below the floor is the neck. Okay. Roof is towards the brain side. Floor is towards the neck side. Itna clear ho gaya? Now come the anterior wall and posterior wall. Now look at me, beta. Anterior wall is towards mandible. All of you, please see. Anterior wall is towards mandible side. Posterior wall is towards the mastoid side, beta. I repeat, anterior wall is towards the mandible side. Posterior wall is towards the mastoid side, beta. Anterior wall, mandible side. Posterior wall, mastoid side, beta. Now we are left with medial wall and lateral wall, beta. Lateral is the outer wall. Look at towards you. Lateral wall is outer wall. What is the lateral wall? Tympanic membrane. Lateral wall is tympanic membrane, outer wall. And the medial wall, look at my hand, brother. If this is lateral, this is medial, lateral and medial. Lateral is the tympanic membrane. What about medial? Medial is that wall behind which lies the inner ear, beta. Please see, external ear, middle ear, inner ear, beta. Okay, lateral wall is tympanic membrane. Medial wall is that wall behind which lies the inner ear, beta. Medial matlab towards inner side. Behind the medial wall lies which ear? Inner ear, beta. Now please see. Okay, again see, beta. Roof and floor. Roof towards brain, floor towards neck. Anterior wall towards the mandible, posterior wall towards the mastoid. And lastly, lateral and medial wall. Lateral, the outer wall, tympanic membrane. Medial wall is that wall behind which lies the inner ear, beta. Am I clear? Thank you, Lalji. Now, everybody, let us discuss the sixth wall of middle ear, beta. Let us discuss it one. Number one, roof. Roof, above it lies dura of temporal lobe of brain, beta. Oh, I know that. कान के ऊपर brain होता है. Above it lies dura of temporal lobe of brain. Now, below the floor lies jugular bulb. Now, what is this jugular bulb, beta? Below the floor lies jugular bulb. Above the roof lies brain, temporal lobe of brain. Below the floor lies jugular bulb, beta. Below the floor lies jugular bulb. Everybody draw a diagram here, beta. You have a next page, you have an empty space. All of you draw a diagram with me, beta. Please see, this is your middle ear, mastoid. Middle ear, mastoid. I told you mastoid is a part of the ear, beta. Okay. Above the ear, draw the dura or brain, beta. Above the ear is brain, beta. Okay. Brain or dura of the brain, temporal lobe of brain, beta. Now behind, this is called sigmoid sinus. Sigmoid sinus, beta. Sigmoid sinus. Okay. There is a foramen here which is called jugular foramen. Jugular foramen is at the skull base, beta. Jugular foramen is at the skull. Jugular foramen. Then comes the neck. After jugular foramen, you come down in the neck, beta. This is neck. In the neck, this is called IJV, internal jugular vein. And this dilatation is called jugular bulb, beta. This jugular bulb, beta. Jugular bulb. This is the venous flow of the brain, beta. This is the venous drainage of the brain, beta. Venous drainage of the brain. Can you see the flow of the venous flow of the blood going down to the heart, beta? So please understand, sigmoid sinus, jugular bulb and IJV are nothing but different names of same structure at different places. I repeat, sigmoid sinus continues down as jugular bulb and jugular bulb continues down as internal jugular vein. Actually what happens is, sigmoid sinus is going to pass through the jugular foramen to continue in the neck as internal jugular vein, but before passing through jugular foramen, it gets dilated to form a bulb called jugular bulb, beta. It's very clear in this diagram, beta, for neuroanatomy also, that internal jugular vein is nothing but downward extension of sigmoid sinus. I repeat, beta, for neuroanatomy, as a doctor you should know, internal jugular vein is the downward extension of sigmoid sinus, beta. Internal jugular vein is a downward extension of sigmoid sinus. These all blue arrows are indicating the final venous return of the brain towards the heart. I learned today that sigmoid sinus, jugular bulb and internal jugular vein are nothing but different names of same structure in three different areas. I learned today that internal jugular vein is a downward extension of the sigmoid sinus of the brain. This is the final venous drainage of the brain towards the heart, beta. I learned couple of things more over in the diagram, beta. The concepts. Above the ear is the brain, behind the ear is sigmoid sinus, and below the ear is jugular bulb. I repeat the concept, beta. Above the ear is the brain, the dura of the brain, beta, and below the ear is jugular bulb, and behind the ear is sigmoid sinus, beta. Look at this concept, beta. This concept, beta, please important. This is important to remember. Above the ear is the brain, below the ear is jugular bulb, and behind the ear is sigmoid sinus, beta. Am I clear, beta? Is it clear to everyone? Above the ear is brain, below the ear is jugular bulb, and behind the ear is sigmoid sinus. Okay, this was about the roof and floor, beta. Let us do the next one, beta. Come to the third wall, anterior wall. We have done the number 1 roof, number 2 floor. We are starting anterior wall, beta. Anterior wall. Anterior wall means towards mandible side, beta. Mandible side. This wall has 2 openings. 2 openings, beta. A, B. Lower opening is for eustachian tube, ET. Upper opening is for tensor tympani muscle, TT. Write down ET, TT. Lower opening is for ET, upper is for TT. ET, TT, ET, TT. Lower opening is for eustachian tube, upper opening is for tensor tympani muscle, which is attached to malleus, beta. Tensor tympani attached to malleus, beta. Malleus. Tensor tympani attaches to which ossicle? Malleus. Okay. And this muscle is supplied by mandibular division of trigeminal nerve. How to remember? TT dot T, beta. Tensor tympani trigeminal. How to remember is tensor tympani trigeminal. TTT. Tensor tympani trigeminal. This muscle is supplied by mandibular division of trigeminal nerve. Mandibular division of trigeminal nerve. So anterior wall has 2 openings. How to remember? ETTT. Make it interesting, beta. Make it interesting, अगर boring हो जाता है ना? Anterior wall has 2 openings. ET lower opening, about TT. ET is eustachian tube, upper is tensor tympani that attaches to malleus, and tensor tympani is supplied by mandibular division of trigeminal nerve. Okay. Now, then comes the posterior wall. Posterior wall has a projection called pyramid. Pyramid is the MCQ, beta. Pyramid is on which wall of middle ear? Posterior wall, beta. How to remember? Pyramid. Pyramid is from our past, beta. Pyramid is past of the humankind. Past. Pyramid, Egyptian pyramid, they represent our history, past of humans actually. Past मतलब posterior. Past, posterior. पीछे वाला. Posterior. Past, posterior. Back side. है ना? So pyramid is on which wall? Posterior wall. Okay. From pyramid, which muscle comes out? Stapedius muscle comes out, and that attaches to stapes. Attaches to stapes. This muscle is supplied by facial nerve. Stapedius muscle is supplied by facial nerve, beta. Stapedius is supplied by facial nerve, beta. Okay, facial nerve. Stapedius is supplied by facial nerve. Very, very important question. Pyramid, beta. Pyramid, from pyramid, which muscle comes out? Stapedius, and that attaches to stapes, beta. And stapedius is supplied by facial nerve. Stapedius is supplied by facial nerve, beta. Okay. Stapedius is supplied by facial nerve, beta. Everybody, try to look at this diagram, beta. If I may. Yeah. Now please see, this is the anterior and posterior wall of middle ear, beta. This is the anterior wall, posterior wall. Anterior wall, posterior wall. Posterior. Which one? This is the anterior wall and this is the posterior wall, beta. First of all, look at the anterior wall, beta. Now, everybody, where is the anterior wall? First of all, this is the anterior wall, beta. Anterior wall. That's the anterior wall. Okay. Now, anterior wall has 2 openings, beta. Number 1 opening and number 2 opening. Number 1 opening is for ET. What is ET, beta? What is ET, everybody? Eustachian tube, beta. This is what the number 1 opening is, ET. What is ET? Eustachian tube. And number 2 is TT. Can you see a muscle here, beta? Tensor tympani muscle. Please see on the beta. Please see on the screen, beta. Please see on the screen. The anterior wall has 2 openings. The lower opening is for ET, upper is for TT, and tensor tympani attaches to which ossicle? Malleus. Tensor tympani attaches to which ossicle is malleus, beta. Which ossicle? Malleus, beta. Malleus. Okay? Am I clear, beta? Now let me go to the posterior wall, beta. Let me go to posterior wall. Now this is the posterior wall, beta. Posterior wall. Let me take you close to it, beta. Okay. Can you see on the posterior wall, this wall, there's a projection here. This projection is called pyramid, beta. Pyramid. Pyramid. Okay. From pyramid, which muscle is coming? This muscle is coming. From pyramid, which muscle is coming? From pyramid, this muscle is coming, beta. This is stapedius muscle, beta. Stapedius muscle. And it attaches to what, beta? It attaches to stapes, beta. Okay, stapes. Can you see stapes, beta? Can you see, beta, posterior wall? This is the posterior wall, beta. Posterior wall has a projection called pyramid. Let me take you close to it, beta. Can you see posterior wall has a projection called pyramid? From pyramid, which muscle comes out? Stapedius. Attaches which ossicle? Stapes, beta. Pyramid on the posterior wall. Which muscle comes out? Stapedius. Attaches to stapes, beta. Now, please see on the screen, beta. Let us make it simple. Now, anterior wall, posterior wall. Anterior wall has two openings. The lower opening is for Eustachian tube, upper opening for tensor tympani muscle. It attaches to malleus, beta. Now posterior wall, this wall, beta, it has a projection called pyramid. This is a pyramid. Posterior wall has a projection called pyramid. From pyramid, which muscle comes? Is the stapedius that attaches to stapes, beta. This is which ossicle, beta? Incus, beta. Right on the side, write down. Incus has no muscle. Incus has no muscle, beta. Only one muscle for malleus, one muscle for stapes. Incus, please see, incus has no muscle, beta. No muscle. Incus has no muscle at all. Okay, incus has no muscle. Now, again see on the screen, beta. Why you need muscles, beta? Why you need muscles? Please see. There is your ossicle, malleus, incus, stapes, beta. Why you need muscle, beta? Why you need muscle? Look at me, beta. Why you need muscle? Look at me, beta. You are sitting in the middle here. I throw three ossicles at you. Don't you think so? There is gravity, beta. They will fall in the middle here. How these ossicles are standing in the air, beta? They're standing in the air, beta. Why don't they fall downwards? Because something has to hold them. From anterior wall comes tensor tympani, it holds the malleus. From posterior wall comes the stapedius muscle, it holds the stapes. Incus is already sandwiched between the malleus and stapes, so incus does not need any muscle, beta. Incus is already sandwiched between the malleus and stapes, so incus would not need any muscle. Am I clear, beta? So basically these muscles are going to stabilize the ossicles so that they don't fall downward. One muscle for malleus, one muscle for stapes, but incus does not have any muscle, beta. Am I clear? Chal. Now let us go further, beta. Next one is the lateral wall. Lateral wall, the fourth wall, is made of tympanic membrane. Of course, lateral wall. Lateral wall is made by tympanic membrane, beta. Lateral wall is made by tympanic membrane. Let me show you the lateral wall. Lateral wall is made by tympanic membrane. Just see on the screen, beta. Everybody please see on the screen. This is your middle ear, beta. Where is the middle ear? This is your middle ear, beta. This whole thing is your middle ear. Can you see malleus, incus, stapes? Okay. Now, this is your external auditory canal. This is your tympanic membrane. This is your inner ear, beta. Okay, fine. Fine, beta. Now, this is the lateral wall of the middle ear. Lateral wall. This is the medial wall of middle ear. Lateral wall is of course tympanic membrane, and medial wall is that wall behind which lies the inner ear, beta. Very simple, beta. Lateral is towards tympanic membrane and medial is that wall behind which lies the inner ear. Okay. Now, can you see, beta, inner ear is hidden behind the medial wall. Now, inner ear wants to show off that I'm also there. So, inner ear creates few projections on the medial wall of middle ear, because behind the medial wall lies the inner ear. So, this inner ear is going to create some projections on the medial wall of middle ear, and those projections are important to remember, beta. Now, open up your notes, everybody. Lateral wall is tympanic membrane, fifth wall. Medial wall, behind this wall lies the inner ear, beta. Medial wall, behind this wall lies the inner ear. Medial wall has two projections of inner ear. A, MCQ, promontory MCQ beta. Promontory is projection of basal turn of cochlea. Promontory is projection of basal turn of cochlea beta. You know cochlea, inner ear, that creates a projection. Which part of cochlea? Basal turn of cochlea beta. Projection of basal turn of cochlea. You might say, Rajiv, where is the cochlea? I'll show you beta. Just see on the screen beta. No problem. Can you see beta over here, everybody? This star beta. This star is the basal turn of cochlea beta. This star is basal turn of cochlea. Can you see it's making a projection on the medial wall? Can you see this wall is projected, is lifted upward, and this projection is called promontory beta. Don't confuse promontory with pyramid beta. Pyramid was a posterior wall. Beta. Pyramid past posterior wall. Promontory is the projection of basal turn of cochlea on the medial wall of middle ear. This is basal turn of cochlea is making a projection on the medial wall, and this projection is called promontory beta. Am I clear beta? Promontory. Number 2. Can you see there are canals also beta? You know, we'll read inner ear. Inner ear got canal also, na? Canal, semicircular canal. So those canal also make a projection beta. Number 2 beta. Number 2. Number 2 is lateral semicircular canal projection called lateral SCC bulge. So two things make a projection. One is cochlea, other is lateral semicircular canal, which is called lateral SCC bulge. What is SCC? Semicircular canal bulge means projection. Okay. So promontory and lateral SCC bulge. Promontory is the MCQ beta. So which canal makes a bulge on the medial wall of middle ear? Lateral semicircular canal, which is a part of inner ear beta. So two projection of inner ear, one is of cochlea called promontory, other of the canal called lateral SCC bulge beta. Now, medial wall also has two windows for the inner ear. I'm sure you know what is the name of two windows. Oval window, round window. Okay, oval window and round window beta. I'm sure you know it. You know, the medial wall has got two window also beta. Can you see? Everybody look at the diagram. Where are we? This is what beta? External auditory canal, tympanic membrane, middle ear, inner ear beta. This is oval window, this is round window beta. Oval window, round window beta. Oval window, round window. Can you see beta? Oval window, round window. Look at this beta. Oval window, round window, where they are? On the medial wall of middle ear. Behind this wall lies the inner ear beta. Oval window is covered by foot plate of stapes. Remember, stapes foot plate is lying at oval window of cochlea. So medial wall of middle ear has got two windows for the inner ear beta. Is the inner ear. Oval window is covered by foot plate of stapes. Round window has got nothing but a membrane called round window membrane. This membrane called round window membrane, also called as secondary tympanic membrane. Okay beta. Oval window is covered by foot plate of stapes. Round window is covered by round window membrane, also called as secondary tympanic membrane. Secondary tympanic membrane is the multiple choice question beta. Now please see, oval window is covered by foot plate of stapes. Round window is covered by round window membrane, also called as mark beta secondary tympanic membrane. Secondary tympanic membrane is other name of round window membrane. Write down secondary tympanic membrane. Secondary tympanic membrane is other name of round window membrane. Lot of question in this table beta. Okay bache? Can we revise it beta? Everybody, let's revise this whole paper beta. Everybody, basic concept. Everybody speak with me. Above the roof of the ear lies brain. Behind the ear lies sigmoid sinus. Below the ear lies jugular bulb. So above the roof is dura of the temporal lobe of brain. Below the floor is jugular bulb. Behind the ear is which sinus? Sigmoid sinus beta. Now anterior wall has two openings. ET, TT. Remember, rhyme it beta. Make it interesting. ET, TT. ET lower opening for you take into TT for tensor tympani, which attaches to malleus. Then posterior wall has a projection called pyramid. Posterior wall. Posterior means past. Past is pyramid is our past beta. Egyptian pyramid past. From pyramid which muscle comes? Stapedius for stapes. Incus has no muscle. Lateral wall is tympanic membrane. Medial wall. Behind this medial wall lies inner ear. This wall has two projections of inner ear, two windows for the inner ear. Two projections are number one promontory, which is a projection of the basal turn of cochlea, and number two lateral semicircular canal bulge. Two window are oval window, which is covered by foot plate of stapes. Round window is covered by round window membrane, also called as secondary tympanic membrane. Okay? Nobody would memorize anything as of now. Understand and get familiar with the notes. Beta. Later on, we'll revise it. As of now, just understand, bro. Just make impression in your heads, beta. Okay, that's important. Don't overwhelm yourself. Don't get, oh, ये भी याद है, वो अभी कुछ नहीं. अभी just get used to what is written where in the workbook and try to imagine with me what we are really going through, beta. Now, everyone, let us discuss the next topic, beta. Everybody open up middle ear cleft, beta. Everybody open up middle ear cleft. Middle ear cleft, beta. Middle ear cleft now. Everybody first understand middle ear cleft. Everyone, middle ear cleft. Now, can you tell me ear lies in which bone? Temporal bone. Middle ear is nothing but a hollow cavity in temporal bone. Itna clear ho gaya beta? I hope by now you are clear that ear, external ear, middle ear, inner ear are temporal bone beta. Middle ear is nothing but hollow cavity in temporal bone. But in the temporal bone, there are many other hollow cavities apart from middle ear. All the hollow cavities of temporal bone combined together are called middle ear cleft. Look at the first line. Middle ear cleft is a combination of all hollow cavities in temporal bone. Middle ear is a hollow cavity in temporal bone, but there are many other hollow cavities in temporal bone. All the hollow cavities of temporal bone combined together are called middle ear cleft. I told you yesterday, we said sinuses. Our skull is a hollow, structure. We had sinus, maxillary sinus, frontal sinus. Similarly, temporal bone has got many hollow cavities. One of them is middle ear, beta. Okay? Even eustachian tube is also part of the temporal bone, beta. It has 5 parts. Number 1, eustachian tube, middle ear, adductus, antrum, and rest of the ear cells. Let's understand it. Everybody draw a diagram with me, beta. You have a space here, or maybe you can draw a small diagram here, beta, with me. Just a small diagram here. Just see over here, beta. This is your middle ear, eustachian tube, mastoid. We are drawing temporal bone, beta. Okay, all of you draw this, the petrous part of temporal bone. This is the mastoid part of temporal bone. This is called the petrous apex. The end of temporal bone is called petrous apex, beta. Petrous apex. There are many cells. The large cell is called antrum. There are many other cells in the mastoid, just like ethmoid cell. You remember yesterday class, ethmoid, beta? Okay. Antrum is a big cell, is the constant cell. And similarly, whole of temporal bone is full of air cell, air cell, air cell. Like yesterday we had ethmoid air cell, we have got today temporal bone air cell, beta. Now, antrum is connected to middle ear through a channel, and that channel is called adductus. Adductus, beta. Adductus connects antrum to middle ear, beta. Adductus connects antrum to middle ear. Adductus connects antrum to middle ear, beta. Okay. Now, at the petrous apex, please to draw 2 nerves, beta. These 2 nerves are 5th and 6th nerves. Trigeminal and abducens nerve lie very close to the petrous apex, beta. Petrous apex. Okay, बच्चे, fine. Done, beta. Okay. Chalo. Now let us start, imagining it further, beta. Everybody, look at screen, beta. This is your temporal bone, beta. This is your mastoid part of temporal bone, like this one. There are many cells in that. This antrum is largest cell, then small cell. This is middle ear here, and they are connected by a channel called adductus, beta. Am I clear, beta? Just to imagine really what is happening there, beta. Adductus. Am I clear, beta? Adductus. Oh, sorry, antrum, beta. This is antrum. Antrum is the largest cell. It's connected to middle ear through a channel called adductus. Inside there is a connection between middle ear and antrum, and that channel is called adductus. Is it clear? This is a hollow bone, beta. Similarly, see this one, beta. See this one. This is your petrous part of temporal bone, and this area is called petrous apex, beta. Let me draw with other color. This area is called petrous apex, beta. This area is called petrous apex, beta. This is petrous apex, beta. This is the petrous apex. Okay. Now this also has got many air cell, beta. This is also temporal bone, na? This is petrous apex, beta. Okay, bache? Fine. Now, at petrous apex, we have two nerves, beta. We have two nerves. Which two nerve? Fifth nerve and sixth nerve, beta. Both sides, na? Fifth, sixth nerve. Which two nerve enter the ear from here? Seventh nerve and eighth nerve, beta. I hope you remember, beta. Seventh nerve, facial nerve, passes through the ear, comes out. Eighth nerve supplies the inner ear, finishes it. Can you maintain the continuity of thought? 5, 6, 7, 8. 5 trigeminal, 6 abducens, facial, vestibulocochlear. From brain. Brain is here, beta. So 5, 6, 7, 8, beta. So try to create an imagination, beta. This area is called petrous apex, my dear friends. This area is called petrous apex, beta. This is the petrous apex, beta. One on this side, one on this side, beta. Very close to brain, beta. Brain is here. This whole is brain, beta. That's here, beta. Am I clear, beta? So this whole bone is temporal bone, is full of air cell. And now look at your diagram, and you have drawn that. Okay, this is the petrous part of temporal bone. Na? This is the mastoid part of temporal bone. Now read your notes, beta. Now read your notes, everyone. Please see your notes, beta. Okay, please see. Antrum is the largest and most constant mastoid air cell. Look at the line, beta. Antrum, it is the largest and most constant mastoid air cell. Everybody, can you tell me yesterday in the ethmoid bone, we said that there is one anterior ethmoid air cell which is constant and the largest anterior ethmoid air cell, and we call it BE. What was BE? Bulla ethmoidalis. Bulla ethmoidalis, beta. Bulla ethmoidalis, beta. Okay. Remember yesterday we labeled that cell of ethmoid which was constant and largest as bulla ethmoidalis. Today we are saying that mastoid has got one cell which is constant and largest, and that cell is called antrum, beta. Okay. It's connected to middle ear. Antrum is connected to middle ear through adductus, beta. ADITUS. Adductus. Adductus, beta. Antrum is connected to middle ear through adductus, beta. Okay. Now read, beta, over here. It has 5 parts. Beta. Number 1, Eustachian tube, then middle ear, adductus, antrum, and rest of your cell. It's easy, beta. Start from Eustachian tube, go to middle ear, then adductus, then antrum, then rest of all ear cells, beta. Rest of all ear cells, beta. Eustachian tube, middle ear, adductus, antrum, and rest of ear cells. Now, next line, beta. Read carefully. All these hollow spaces are mucosa lined and are interconnected. These all cells are interconnected, but they're one part of one system. But can you see? This is Eustachian tube, middle ear, adductus, antrum, and rest of ear cells. All these are interconnected system, beta. All are interconnected and mucosa lined also. Like sinuses are mucosa lined. These cells are also mucosa lined, beta. Look at screen, everyone. All these cells are interconnected, beta. Look at screen, everyone. This is your middle ear cleft, beta. Okay, please see. This is your mucosa of the nasopharynx. But you know nasopharynx? Same mucosa goes like this. It lines the middle ear. Same mucosa lines the editors, antrum, and all the cells are mucosa lined. Beta. My dear friends, all these cells, even petrous also, all these cells are mucosa lined. Beta. Every cell is mucosa lined. This system is interconnected. Beta. Let us revise. Beta. There are 5 parts of middle ear cleft. Everybody speak with me. Number 1, Eustachian tube. Number 2, middle ear. Number 3, adductus. Number 4, antrum. And number 5, rest of the ear cells. And we learned today that this all system is interconnected and mucosa lined. When I say interconnected, beta, look at screen, beta. By chance, you got infection in the nose, beta. Okay? Some cold happened, beta. Now the infection reached from here, from middle ear, it reaches the middle ear, beta. The bacteria went through the Eustachian tube, reached the middle ear, beta. And this stage of disease will be called the otitis media. Otitis media, beta. Otitis media, मतलब middle ear infection. Now, by chance, the infection spread from adductus and all the cells of the mastoid got infected. This stage of disease is called mastoiditis. Mastoiditis. By chance, infection went from here and reached over here, beta. And that stage of disease will be called petrositis, beta. Petrositis, otitis media, mastoiditis. This is one spectrum of the disease only, beta. Okay? So problem started from the nose to nasopharynx. You just started with a cold, basic cold. And then infection went from the Eustachian tube to middle ear called otitis media. If it goes from middle ear to mastoid, it's called mastoiditis. If it goes from middle ear to petrous apex, it's called petrositis. So this system is interconnected, beta. Okay? Now open up your notes, beta. Open up your notes. Let us do the next topic, beta. Please see spread out disease, beta. I've written the same thing. Nasopharynx to middle ear, otitis media. Nasopharynx to middle ear to mastoid, mastoiditis. And middle ear to petrous apex, petrositis, beta. So this system is interconnected, beta. Am I clear? Chalo. Let us go further, beta. Now next topic is diseases of middle ear cleft. Once you understood that middle ear cleft is interconnected system, let us discuss now various diseases, beta. Now label it. Number 1, beta. Everybody, number 1. ASOM. ASOM, very common problem in my practice. ASOM, acute suppurative otitis media. Acute suppurative otitis media. Look at the name. Acute suppurative otitis media means infection of middle ear. It is infection of middle ear mucosa by pyogenic organism. Suppurative means pyogenic. Okay, it is infection of middle ear mucosa by pyogenic organism. Most common organism to cause this is Streptococcus pyogenes. Streptococcus pyogenes, beta. Most common organism to cause is Streptococcus pyogenes, beta. Infection reaches middle ear from nasopharynx via ET, beta. Very, very simple concept. The problem will always start from nasopharynx. The bacteria will travel via the Eustachian tube. It reaches the middle ear, beta. So problem starts from the common cold. Generally, people have got cold, and then the problem happens in the ear. What is the chief complaint? Earache. Earache, beta. Earache. Okay. Examination shows, draw, beta, red tympanic membrane with dilated capillaries. What is the normal color of tympanic membrane? Everybody. What is the normal color? Pearly grey. This is red tympanic membrane with dilated capillaries. Can you see beta red tympanic membrane, beta? Red tympanic membrane with dilated capillaries, beta. Now this is called cartwheel sign, beta. This is called cartwheel sign. Cartwheel sign. This is called cartwheel sign, beta. Cartwheel sign. This is called cartwheel sign, beta. Cartwheel sign. This is called cartwheel sign. Okay. Now treatment is medical management. This is no MCQ, beta. This is antibiotic, painkiller, decongestant for cold. You have to give that, beta. Okay. Infection, antibiotic, painkiller for pain, and then decongestant for the cold, beta. But no drug of choice like that. Okay. But the question is this one, beta. Please highlight. This is MCQ. ASOM patient with red. The key word is bulging tympanic membrane. ASOM patient with red, under the word bulging, not red tympanic membrane. Red and bulging tympanic membrane means there is so much of pus filled in the middle ear that if you did not do anything, then nature is going to cause the perforation of the eardrum and the pus is going to come out better. Okay? If you did not do anything, the pus will flow out of the middle ear like this data. The red bulging tympanic membrane means the middle is full of pus, and there's so much of pressure on tympanic membrane that if you did not do anything, the pressure of the pus will perforate the tympanic membrane and the pus will flow out like this beta. This is a problem, it's a complication. You don't want this to happen, do a simple surgery. What? Just do one thing beta, do one thing, why not give a cut on the tympanic membrane beta, like this. What is the name of this surgery beta? Maryngotomy. Remember, maring means tympanic membrane, otomy means to give a cut. The treatment is maryngotomy. This is a serious problem. You want to avoid this, you give a clean cut on the tympanic membrane surgically, you put a suction, suck the pus out, this cut will heal within few days automatically. With antibiotic, pus will dry and the cut will heal better. This will save the perforation in this patient better. Otherwise, this will happen better. Okay. Now, look at the screen better. Look at your notes. Treatment is maryngotomy. This is MCQ better. Surgery. Maryngotomy surgery. And in which quadrant? Posterior inferior quadrant. Posterior inferior quadrant. MCQ beta. Anybody can tell me, in glue ear, the maryngotomy is done in which quadrant? Anterior inferior beta. Glue ear, anterior inferior. ASOM, posterior inferior. Glue ear, maryngotomy came beta. Glue ear, maryngotomy word came in the glue ear. In glue ear, the maryngotomy is done in anterior inferior quadrant. In ASOM, the maryngotomy is done in posterior inferior quadrant beta. Okay. Now read it beta. If no management is done in a patient of ASOM with red bulging TM, it will lead to perforation of tympanic membrane. Can you see beta? It will lead to perforation of tympanic membrane. Please show over here beta. And the pus will come out beta. Please show the pus has come out beta. Pus. If you do not do this maryngotomy, then the perforation will happen and the pus will come out. It's very common. It's very common, but a lot of people don't reach the ENT doctor. In villages, there are no doctors available, so they don't get the maryngotomy done and the pus will come out. Very common problem. This pus will come out. Now, put an arrow. Still the story is continuing better. Now, if no treatment is taken for next 3 months, further, if no treatment taken for next 3 months after this, it will lead to permanent perforation. Draw it like this. Permanent perforation. Perforation happened. Still you ignored it. In villages, we don't have doctors. ENT doctors are not there. If perforation happened and if no treatment taken is for 3 months, this perforation will become permanent perforation. Means it will never heal on its own now till the time you do surgery. You will have to do surgery for this and it's called permanent perforation. This disease is called safe CSOM. This was ASOM, acute. CSOM is chronic. A was acute, C is chronic beta. Why safe? It's not a risky disease. Only perforation is there. You can manage it easily. Patient won't die of this problem. Safe matlab, patient won't die of this problem beta. Okay, bache? Fine. Okay. Now, everyone, this is a permanent perforation beta. It's a permanent perforation. Permanent perforation beta. Permanent perforation. Can you see beta? This is a typical perforation look like beta. Can you see a hole over here? That's a permanent perforation beta. Very common disease. Let us do this now. Safe CSOM beta. Number 2 disease beta. We are done ASOM. Number 2 is safe CSOM. We are doing disease of middle ear cleft beta. ASOM. Perforation happened. You ignored it for next 3 months. The perforation became permanent. And now this stage of disease is called safe CSOM. What is C beta? Chronic. Safe means no risky disease. It won't kill the patient. It is also called tubotympanic CSOM. Tubo means the problem started from the eustachian tube side and it came to the middle ear. Tubo means eustachian tube, tympanic means middle ear. Tubotympanic CSOM is other name of safe CSOM. It is characterized by the presence of permanent central perforation in pars tensa of tympanic membrane. It is characterized by the presence of permanent central perforation in pars tensa of tympanic membrane. Three word beta: permanent, central, pars tensa beta. Number one, permanent perforation. Number two, central perforation. And number three, in the pars tensa of tympanic membrane beta. Anybody, what is the lower part of tympanic membrane? Pars tensa. Remember, this is pars flaccida. This is not, there is no perforation in this area beta, okay? Safe CSM should not happen in this area beta. I hope you remember the lower part, the bigger part is pars tensa. So this kind of safe perforation, permanent perforation in pars tensa is safe CSM. It is presence of permanent central perforation in pars tensa of tympanic membrane. I do remember pars tensa is the lower part of tympanic membrane beta. Upper part, small part is flaccida. That is not safe CSO beta. Okay. Now, chief complaint: ear discharge. Why ear discharge beta? Please write down beta. CSOM. What is S? What is S? Anybody? What is S? Bolu, what is S? Suppurative. Think logically. Chronic suppurative otitis media. Na? Suppurative means pus. Ear discharge. Discharges not foul smelling, not blood stain. Not foul smelling, not blood stain. Simple pus. Can you see beta? Simple pus coming? Only pus, no smell, no blood beta. Not foul smelling, not blood stained. Okay. Then conductive hearing loss. Yes, middle ear problem na? CHL. Conductive hearing loss. Then ossicle erosion beta. In long-standing cases, there can be ossicular erosion also beta. In long-standing cases, there can be ossicular erosion also. If the patient doesn't take any treatment, there can be ossicular erosion also. Okay. Now please see on the screen beta. Can you see over here beta? Can you see? This is malleus, incus, stapes. This is the ossicle erosion beta. The incus has been eaten away. Malleus, incus, stapes. Gradually full incus will go. After that malleus will also go. Okay, but problems start mostly from incus beta. Now you have a question, write down. Most common first ossicle to be eroded is incus beta. Why incus? If you remember, incus has no muscle attached to it, so it has least blood supply. MCQ beta. So it has least blood supply. Anybody? Which muscle attaches to malleus? Which muscle attaches to malleus beta? Tensor tympani muscle. Which muscle attaches to stapes? Stapedius muscle. Which muscle attaches to incus? I told you, incus has no muscle. And I hope, look at me beta. Look at me, I hope you know, every muscle brings some blood supply for the bone. Incus has no muscle. Therefore, incus has least blood supply. Already avascular ossicle. It means easy to damage this one beta. Okay, disease can easily eat away this ossicle. So the story always starts with incus, but very soon, whole incus will be eaten up, whole malleus will be eaten up beta. Then stapes can also be eaten up beta. But if ossicle erosion also happen, that will increase the hearing loss beta. Ossicle erosion will increase the hearing loss beta. Ossicle erosion will increase the conductive hearing loss beta. Incus is the MCQ beta. Both are MCQ beta. Why most ossicle to be eroded is incus? Why incus? Because incus has least blood supply beta. Now, treatment is of course surgery, but I told you it's a permanent perforation beta. Think about it. First, look at the first definition. It is presence of permanent perforation in pars tensa beta. You have to do surgery. There is no role of antibiotic, ear drop in this patient. Only thing that you have to make the ear dry before you operate. That's otherwise perforation will never heal on its own. It's a permanent perforation. Surgery is required. The surgical option is laryngoplasty. When you open up the ear from behind and you just put a graft over the perforation. It is the repair of laryngoplasty. Look at the name, laryngoplasty. What is laryng? Tympanic membrane. What is plasty? Repair. Now look at the definition. It is repair of tympanic membrane perforation using a graft. Okay. Most commonly used graft. Everybody note down. Most commonly used graft is temporalis fascia graft. Temporalis fascia graft. Most commonly used graft is temporalis fascia graft. You know, everybody, what is this muscle beta? What is this muscle here? Temporalis muscle beta. This is the graft. From this muscle you take a graft. Most commonly used graft is temporalis fascia graft beta. Okay, bache, fine. Now, we open up the ear from behind, okay, and this is the future question beta. This instrument has been asked in NEET PG beta. This instrument has been asked in NEET PG. It can be asked in your exam also, beta. We use a retractor, Mollison self-retaining master retractor, beta. What is the name, beta? Bolo, beta. Mollison self-retaining master retractor to expose the area, beta. We use Mollison's self-retaining master retractor to expose the area, beta. Look at me, beta. When you give a cut, how will you expose the area? You know, in surgery we use retractors. In ENT for ear surgery, what is the name of retractor? Bolo, beta. Mollison self-retaining master retractor. Beta. We put the retractor and we open it, the whole skin goes away from each other, beta, and ear is open over there. So we give a cut behind the pinna and we use this retractor to open up the tissues, beta. Okay, fine. We use which retractor? Mollison self-retaining master retractor, beta. What is the name of surgery? Laryngoplasty. It's a microscopic ear surgery, beta. You do it under microscope because it's a tympanic membrane is a very small structure, beta. It's not very big structure, na? So you're operating under microscope, beta. Please see, this is a Mollison self-retaining master retractor. Don't forget this one, beta. Okay, this is Mollison self-retaining master retractor, beta. Okay, fine. Which graft we take? Side of skull, beta. What is this muscle? What is this muscle, beta? Temporalis muscle. Can you see temporalis muscle has got a fascia here? You take a small piece of fascia and you put over there, beta. But this is the before surgery. There's a perforation. Then you put a graft. It's healed completely. Can you see, beta? Before and after, beta. Can you see? Before and after, beta. Can you see? Beautiful results, beta. Before surgery, there is a big central large perforation, which is permanent perforation. You did a laryngoplasty. You put a, can you see white graft over there? And the graft has healed the perforation. Beta. Laryngoplasty. It's repair of tympanic membrane perforation using a graft. Most commonly used graft is temporalis fascia graft. We open the ear from behind and we use a retractor called Mollison's self-retaining master retractor to expose the area. And it's a microscopic ear surgery, beta. Okay. Now there are some other surgery option, beta. Type 3 tympanoplasty, beta. Type 3 tympanoplasty, the second surgery. Now laryngoplasty is very simple surgery. Perforation, graft, khatam. Kuch bhi nahi. But type 3 tympanoplasty is this is done. This surgery is done, beta. This surgery is done. Surgery is done when disease has eroded malleus and incus, beta. M minus, I minus, S plus situation. Only stapes is left, beta. I told you, disease can eat away the ossicles. First is gone is incus, then malleus also gone, beta, in some cases. In this patient, malleus and incus both are gone. Only stapes is left, beta. Now look at me, beta. Look at me, everyone. Look at me. I hope you remember, look at my hand, beta. Tympanic membrane and ossicle work as one unit. Remember, they move together. Tympanic membrane, malleus, incus, stapes, they work together and they stimulate the cochlea together. But now, situation is different. Beta. What is the situation? Tympanic membrane is here, no malleus, no incus, only stapes is here, beta. No problem, beta. Please understand it, beta. Please understand it, beta. This is malleus, this tympanic membrane. Normally what was happening? Tympanic membrane, malleus, incus, stapes, cochlea. But now, tympanic membrane, there is no malleus, no incus, only stapes. Now, how will the sound energy reach over here, beta, now? Then, please don't forget, you have got a perforation of the tympanic membrane also. You are doing the surgery for perforation, by the way. Now, you put the graft in such a way that it start touching the stapes directly, beta. The graft has to be pushed few millimeters inside. It's not very far away. It's not a kilometer away from each other. It's just, remember, depth of middle ear, 6 millimeter, 2 millimeter, 4 millimeter. That's all. Millimeter. What you do is, look at me, beta. This is stapes. This is tympanic membrane. You put the graft in such a way that it touches the stapes directly. It's only few millimeter away. So that continuity of sound transmission is maintained. Because if you put the graft like this, which graft? Graft to seal the perforation. If you put the graft like this and stapes is here, how will the sound energy go from tympanic membrane to the stapes, beta? There's a difference between the two. So you do one thing, you touch the graft of tympanic membrane with the stapes, beta, so that continuity of sound transmission is maintained. This surgery is called a type 3 tympanoplasty or columella tympanoplasty. Columella tympanoplasty. Look at screen, beta. Look at screen, your notes, beta. This surgery is done when M minus I minus S plus situation, the graft of tympanic membrane is placed in contact with stapes. Okay, this surgery is also called as columellar tympanoplasty. This is the MCQ beta. Columellar tympanoplasty is other name of type 3 tympanoplasty beta. Once again revise with me. What is type 3 tympanoplasty surgery? It is done in which situation? M minus, I minus, S plus situation, means only stape is left. In this case, we do the tympanic membrane surgery. We put a graft of tympanic membrane in such a way that you touch the tympanic membrane graft in contact with the stapes. Why? So that continuity of sound transmission is maintained. This surgery is also called as columellar tympanoplasty. Main surgery is maryngoplasty, which is perforation should be repaired with the graft. Most commonly used graft is temporal is fascia graft, and we use a retractor, and the retractor is called Mollison's self-retaining mastoid retractor. Sometimes you do surgery called type 3 tympanoplasty. It is done when there is a malleus minus, incus minus, stapes plus situation. The graft is placed in contact with stapes, and this surgery is called type 3 tympanoplasty or columellar tympanoplasty. Okay, bache? Fine. This was about the second disease beta. Okay. Now, I hope you remember we are doing a topic of middle ear cleft diseases. We did ASOM, we did safe CSOM, and we just will, after the break, we'll do number 3, mastoiditis beta. Story continues beta. ASOM, perforation happened. 3 months passed, permanent perforation happened. Safe CSOM. I told you from middle ear, if the infection goes to the mastoid, all the mastoid cell can be infected, and that will be called mastoiditis. I told you from middle ear, infection can come to mastoid. So we have a lunch break now, but once the lunch break finishes, please come with excitement to learn the next level of disease, that when the infection reaches the mastoid cells beta. Okay, so it's a 45-minute lunch break, and we start again at 1:45 beta. 1:45. Okay, it's a lunch break till 1:45, and we start again at that beta. Eat little lesser, take some coffee, tea, wash your face, take some sandwich, some rice, some dal, something like that, but don't eat too much. Get back with a passion to learn mastoiditis, petrositis, unsafe CSOM, how other diseases are actually evolving further. And this is continuity. Okay, fine. Chalo. See you again at 1:45.